For the last 5 years, the Riordan Clinic has gotten more involved with the prescription of natural hormones. And one class that's very important is the so-called gender hormones. Some people call them the sex hormones. This would be estrogen, testosterone, progesterone, and to a certain extent, DHEA, which is an adrenal hormone. So these are also referred to as anti-aging hormones. Typically, before about 1950, the life expectancy was about 46 or 47 years of age. After the introduction of antibiotics and better refrigeration, better sewage control, a number of factors have led to better medications and cleaner home environment. This has led to a big jump in life expectancy. The average male will live to about 76, 77 years of age, and a female will live to 79 to 80 years of age. So it's around 50 for most women, and sometimes older for men, that their hormone levels will begin to wane. In women, it happens pretty suddenly in menopause. In men, it can happen much more slowly. Nevertheless, as hormones go down, quality of life goes down. Fatigue, confusion, memory problems, and in women, hot flashes, mood disorders, increased weight gain. In men, there's a greater depression and mood disorders as a result of loss of testosterone. Testosterone is very important for maintaining skeletal muscle mass, and in both men and women. And so this shows up as a loss of muscle mass and increasing fatigue and weakness when these hormones diminish. Most people look upon this as natural. This is a natural thing that happens, especially in women. This is the change of life. But we find that as a result of this, much of the quality of life that we would normally expect during the golden years is lost. And these chronic symptoms and loss of normal functioning makes the aging process much less desirable than maybe what we might have otherwise expected, especially when it's our turn to get old. And so the new thinking is that through the use of bioidentical hormones that are carefully prescribed and monitored, the individual can safely maintain their hormone levels, and as a result, maintain their muscle mass, their bone mass, their brain functioning. Even such areas as skin can be in better shape, better quality. For women, vaginal health is very important. For men, it can be an issue of libido and erectile functioning, though there are other factors that can enter into that besides the hormones. But looking at it from the big perspective, hormone replacement therapy, when done safely through careful monitoring every 6 months, can result in markedly improved quality of life. And this is a way of taking the sting out of the aging process. There have been reports from conventional medicine raising concerns about hormone replacement therapy. Most of these stem from a study that was done about 10 years ago using synthetic hormones in women. And these were women who had been menopausal sometimes for as long as 15 or 20 years. And so much of the changes had already occurred. So these hormones do not reverse the aging process. They mostly just slow it down. And so it's wise to start as soon as menopause occurs or as soon as the hormone levels drop off. But in order to maintain safety, we have found at the Riordan Clinic that measuring these levels every 6 months and then adjusting and customizing the dose to keep them in the safe range is by far the best way to do bioidentical hormone replacement therapy in both men and women. So we invite you to check out our website. You can also go to YouTube, Riordan Clinic, and type in hormones or bioidentical. And I have a lecture there on the safety of using bioidentical hormones in this kind of a fashion where we do monitor every 6 months and carefully coach people on how to make the best use of these natural compounds. So thanks for tuning in, and we'll have more questions from the Riordan Clinic on this channel. Thank you.